Hi, my name is Monica Ferry, and this is my mini study analysis table presentation for my research project. My research question is misoprostol better than oxytocin for treating postpartum hemorrhage in out-of-hospital settings following expectant management of third stage? And the reason I chose this topic is because in the clinical setting, I have seen different midwives go for different drugs and have different reasons for them, and some prefer one more than the other. And so I figured I'd delve into the literature to see what it has to say about that. And one of the difficulties I've been coming up with is finding any information on any studies done on women who have not received active management. Since active management of third stage is sort of the standard, most of the studies deal with which drug is the most appropriate for active management when we're preventing hemorrhage. And so I'm kind of piecing things together because I'm interested in what to use during expectant management, since that's mostly what I see in home birth situations. So the first study I'm looking at is Musa et al. It's a double-blind randomized controlled trial comparing misoprostol and oxytocin for management of the third stage of labor in a Nigerian hospital. And the purpose of this study is to compare the efficacy and adverse side effects of oral misoprostol with those of oxytocin for AMTSL. Now, again, I'm interested in expectant management, but I figured that this study would have some good indications of how the two drugs work and which is better at stopping hemorrhage, and what the side effects might look like. So the results of this study were interesting. This was in 2015, so just about 10 years old. There were no significant differences in bleeding or hemoglobin levels between the two groups, which were the two things that they were measuring. So the researchers found that misoprostol is efficacious and a good alternative to oxytocin among low-risk patients, especially in situations where storage of oxytocin is difficult. And this is one of the things we come up with, and one of the reasons some midwives prefer misoprostol is because when you're traveling to home births all over the place and your birth bag might not be able to be refrigerated, and it's a little easier to carry misoprostol around. So the second study I'm looking at is Koch and Rotman, the use of misoprostol in the treatment of postpartum hemorrhage, a pharmacoepidemiological approach. And this is to identify the clinical and epidemiological profiles of the use of misoprostol for treatment of postpartum hemorrhage. This study used the data that was collected from drug orders and electronic medical records. It was an after-the-fact observational study looking at a bunch of different results from people who had received misoprostol. And the conclusions were they had a success rate defined as cessation of bleeding without any need of complementary interventions, and that success rate for misoprostol was 84.7, which the researchers considered to be high. And they concluded that this makes it an effective pharmaceutical option for controlling PPH. However, it was often used as a third drug in treatment. So it's difficulty to assess if this efficacy is independent of other uterotonics or not. And the small number of cases made it a little bit of a weak point for this study. Although one thing that was interesting was that some of the women who were given Methergin did actually have hypertension, 4 of them, and that is a contraindication for receiving Methergin. And so it's possible to take from this that misoprostol might have been a good alternative for women who were hypertensive. So the last study I'm looking at is by Megan et al., and this is the safety and feasibility of a family first aid approach for the management of postpartum hemorrhage and home births, a pre-post intervention study in rural Pakistan. So this was an interesting study when I'm looking at how misoprostol can be used in situations where oxytocin might not be as available. And again, as home birth midwives, we should be able to administer oxytocin, but it is a little bit harder to store and to draw up and use in a pinch. And we're not talking about using it for active management when we know we're going to need it. It's more, what drug do we use when we are already seeing a hemorrhage happening? And so being able to work quickly and have something that is readily available is a priority. And so this study was looking, was done in Pakistan, in very rural, low resource areas, and it was to compare the efficacy and adverse side effects of oral misoprostol with those of oxytocin. And women were identified by local birth attendants, and the researchers met with them and gave them some education about identifying postpartum hemorrhage themselves, and then gave them some special pads to measure blood loss with, and misoprostol, which they taught them how to administer in the case that postpartum hemorrhage was identified. And so this study is really looking at how misoprostol can be used in situations without skilled birth attendants. And they interviewed the women before they gave birth and gave them the information and the drugs, and then they interviewed them within 4 days of the birth. And their results showed that the women had pretty good knowledge and awareness of postpartum hemorrhage and a positive experience of taking misoprostol. Now, one of the weaknesses of this trial was the sample size was too small to really assess the effectiveness and approach of this approach on morbidity and mortality. Now, and then of course it was relying on the women, recalling things themselves. So there's an possibility for recall bias and self-reporting error. Now, the authors did say that this study suggests that there is a need to rethink the way that families can be integrated into their care. And I thought this was interesting in terms of having a solution that involves families themselves and empowers them in their own care. And this having misoprostol available seems like something that could really empower families to be a part of their own care. So thank you for watching my video.